I have two practices, and one's in Arlington and one's in Southlake. Both of our offices offer world-class, state-of-the-art equipment, I would say cutting edge. So when a patient comes in, 4 hours later, they're going home with a tooth that's had a root canal, the tooth has been built up, and the permanent crown that looks beautiful. They're walking out with it. When Ryan came into our office and sat down, and an hour later he was leaving with his final crown, he was totally amazed. And this is just one of our services that we offer our patients. So what I've done is take an optical or a digital impression of Ryan's tooth, and the computer has come up with this image, and I'm just analyzing it, making sure that it looks pretty accurate. And I've already outlined the margin, and since Ryan's only 19 years old, we're going to pick the youth anatomy, and now the computer's going to fabricate the crown digitally. And as you can see, it's figuring out where to place the margins, the anatomy. It's incredible what it can do. It takes a couple of minutes, and then what I do is I kind of just sit here and make sure everything looks great. I can actually look at the inside of the crown and see how it looks. And after that, if I like it, what I do is I push the mill button, and what this does is sends all the information to our milling center. It's actually going to fabricate the crown out of a solid block of porcelain, and it'll be ready to cement in his mouth in about 14 to 15 minutes. We're able to give patients access to equipment that I would say most dentists are envious of. The technology that we offer our patients and the comprehensive treatments that we do. The patients are able to stay in this practice and not have to go to different offices for treatment. And with the ability of the CAT scan, we're able to precisely place implants and not wonder where we're aiming for. I would say the number one passion for my office is the technology that I offer my patients. It's an incredible array of equipment, also education, staff. The whole combination is incredible, and what I offer the patients is, I would say, top-notch dentistry. With the traditional orthodontics, a patient has to use brackets and metal wire to move the teeth, and we really don't know what the outcome is a lot of the times. With Invisalign, we take impressions of your teeth, and then we send it off to the company, and the company can fabricate these plastic aligners or trays. What the patient does is they put these in, wear them for about 22 hours a day, and after about 2 weeks they put a new aligner in, and usually the treatment's about 6 to 12 months, and we can move teeth pretty fast.
Invisalign I highly recommend. My procedure for myself was only 32 weeks. Within 32 weeks I had a large gap between my teeth. It's completely gone.
We have a 3D computer graphic that shows from stage 1 to the very end what it's going to look like, and every time a patient walks in, sits down, we kind of show them what stage they're in, and that's basically it. It's so easy. Lewis is a great example where, he came in, he's not wanting any kind of brackets or wires.
Invisalign was probably the greatest choice I could ever make, because I didn't want to wear braces and feel like I was a 15-year-old kid.
So what we were able to do is start Invisalign, get him to a stage where I felt comfortable with preparing his teeth for the veneers, and what we did was we saved a lot of tooth structure. At the same time, we were able to close not only his gaps in his front teeth, but he had lower anterior crowding or lower front teeth that were crowded, and we were able to straighten that out. So he's overall 100% satisfied.
Before Invisalign, I couldn't even talk to people because I felt like they were looking right at my teeth all the time. So I did Invisalign, and it was great. I enjoyed the process, and now I can't stop smiling.
Everybody's professional, everybody's helpful. They answer all your questions, anything you can think of, they're ready with an answer. It's wonderful.
So between our Southlake and Arlington offices, we're able to provide incredible high-tech care for all of our patients. One of the great things that we can do here is smile makeovers, and Fran, when she came in, her main concerns were her front 2 teeth. She didn't really even care too much about her back teeth. She just wanted to be able to smile.
I was at a Thanksgiving dinner, and I had my little nephew sit on my lap, and he was looking at me and he said, "Aunt Fran, what's that black spot on your mouth?" And I said, "Well, I have a cavity there, and I'm too scared to go and get it fixed. And I know that I'm a grown-up, but your aunt is too scared." The one thing that I was worried about the most was I do have anxiety, and I did not want to be awake on any procedure.
Well, a lot of patients think that when they see the dentist, they associate it with pain from watching movies and TV shows, but actually we have the ability for them to not even remember an appointment.
And so the one thing Doc told me was I could either do oral sedation or I could do IV, and I chose oral, and that was wonderful because every procedure, which I have had many, I have done oral and have been fine. And had I known that, I don't think I would have waited this long to get my mouth done.
When Fran came in wanting her front 2 teeth fixed, we were able to point out the other deficiencies that she had in her mouth, including the infected root tips that she had, the infected teeth, the teeth with large cavities, and so we were not only able to take care of her front 2 teeth, but we were able to restore her entire mouth.
I needed a lot of things, but when I first walked in, I was really, really embarrassed because I was afraid to let the dental hygienist see my mouth or Doc. And when I was in the room, he just made me feel completely comfortable. He told me everything that he was going to do, and he knew my anxiety was off the charts because I was already crying, and he just made me feel so comfortable and so at home, and he was so professional about everything that he was presenting to me, and I just felt like I was in a safe place. It took me literally 3 to 4 months to finally make myself walk through the front door, and now that I have, the Smile Makeover has just changed everything about me, and I love Doctor. I love everything about him and everything that he's done to change my life.